I'm Dr. Vic Goradia. I'm a knee and shoulder specialist with G2 Orthopedics and Sports Medicine in Richmond, Virginia. I'm introducing a video on arthroscopic double row rotator cuff repair. This shows a fairly standard sized rotator cuff tear that I've repaired anatomically, all arthroscopically. In some cases, people tear their rotator cuff to a lesser degree that can also be repaired arthroscopically. However, in some cases, people have very large and complicated rotator cuff tears that in many hands requires an open surgical procedure. Based on my experience over the past 15 years of repairing these types of tears, I'm able to repair almost all of them arthroscopically.
This diagram shows a torn rotator cuff tear that's being grasped so that it can be reattached back to the bone. Here's the rotator cuff tear, and this is where it normally attaches onto the bone. We're going to initially debride or clean up the torn edges of the rotator cuff so that we have healthy tissue to reattach. We're also going to remove some of the soft tissue or the residual tissue on the bone so that we have a healthy surface to reattach to. This is a different view that shows the rotator cuff, and underneath it you can actually see the humeral head and glenoid, or the ball and socket. We're going to take a Arthrex Scorpion device to pass suture through the torn rotator cuff. This is called a fiber link suture that will be used to pass the actual sutures and tape that we're going to use for the repair. This is a punch that we're using to create a small hole in the bone so that we can insert a anchor. This Arthrex swivel lock anchor is a biocomposite material that will actually turn into bone over time. It is preloaded with the blue thicker suture called fiber tape. Because it's thicker than normal suture, it allows more surface area for fixation. We've now passed the fiber tape suture through the torn rotator cuff. There's the blue fiber tape suture that we've passed, and then we did a second anchor with the white fiber tape suture. We have a small dog ear of tissue left in the back here, and so we're going to put a fiber link through that dog ear, and that'll help us to bring it down. So this is called our medial row in our double row repair. We're going to now take one white fiber tape and one blue fiber tape so that they crisscross over the top of the tissue of the rotator cuff, and we'll bring it out into what's called a lateral row for our double row repair. We're now using the same punch for the lateral row to create a small hole for our swivel lock anchor. We've passed the fiber tape through the eyelet in the anchor, and now we're going to secure it down into the bone and create appropriate tension. So I'm going to be able to tension each of the suture strands. You'll see right there I've pulled the blue a little bit tighter so that we have appropriate tension. There we go again, and now we're going to screw in this biocomposite anchor. This will give us the first of our two lateral row anchors. Now we're going to cut the excess suture material flush with the anchor. We're going to repeat the procedure and take the remaining sutures and secure them down into the bone. This creates a nice fixation for the rotator cuff. So we had our torn rotator cuff that we have attached back to the bone in a double row configuration where we have a medial row and a lateral row. And this is what it looks like. That's our medial row, and this is our lateral row. And now we have secure fixation.